Redditors who have had major health issues, what small symptom should you have looked into earlier? If you have testicular pain, don't frick around. Seek medical attention immediately. I had testicular torsion and got lucky. A lot of men have lost a both testicle to this. First friend. He was a Finnish carpenter and was hand sanding in a deep shelf area and got a splinter, more like a sliver of wood, into the cuticle of his pinky. It was pretty freaking big and he was like, it'll work its way out on its own. So, he left it alone and a red line started to move along his arm from his pinky up into his armpit. He finally got convinced to go into the doctor. Turns out the red line was an infection traveling along his vein. And had he not gone into the doctor when he did, they said the infection would have ended up in his heart and would have been extremely life-threatening at that point. Second me. My best friend was in the hospital. Eventually he ended passing. But all the stress of him in the hospital and continuing on with his passing, I was beginning to have gnarly cramping and waking up to use the bathroom like every hour or two. And not only that, but waking up almost crapping myself and then spending more and more time on the shitter each time. Like having the urge to go without being able to go after initially going. Long story short, ended up with a pretty severe case of Crohn's disease and ended up having some pretty serious 6-hour surgery to remove part of my intestine, bladder, and colon. Yay. Not me, but my wife. She had a rare liver disease that sprung out of nowhere when she was 23. Her initial symptom wasn't jaundice, yellowing of the eyes skin, like liver diseases tend to start showing themselves with, but extreme itchiness. She figured it was just really dry skin. Turned out to be PSC, primary sclerosing cholangitis, but she's 2 years post-transplant and doing great. I experienced a pain in my left shoulder, trapezius muscle, whenever I consumed alcohol, which for me was an infrequent beer. It was odd, but not too concerning, since I didn't drink very often. Turns out, I had Hodgkin's lymphoma, and the pain in lymph nodes on the consumption of alcohol was a symptom seen in only a very small percentage of cases, less than 5%. Anytime I consume alcohol my back aches, almost as if my bones or muscles are iced over, so uncomfortable that I do not often drink. I always got the strangest looks complaining about that. Will def be more vigilant thanks to your unfortunate story. My dad has a lot of moles and my mom forced him to go to the dermatologist because he hadn't been in years. She was worried about a few of the big moles that she thought might be getting bigger. The dermatologist pointed one out and asked if that was one they were concerned about, and no. My mom said that one actually seemed like it was getting smaller, so why would she be concerned? Doctor informed my parents they were doing a biopsy right there and then and cut a 1.5-inch long chunk out of my dad's back. It was melanoma, the really bad skin cancer. It turns out, if a mole is getting smaller, it's probably because the immune system has a reason to attack it. Anyone asking after my dad's health? The melanoma was only stage 1 because the dermatologist caught it so early. He's doing fine now. This was 8 years ago. He's had another mole removed in the past few years and goes to that same dermatologist twice a year because he has quite literally hundreds of moles freckles. My mom also checks on his more concerning moles pretty often, and if she thinks they look strange, off to the dermatologist he goes. The standard for when to be concerned about moles is ABCDE. If a mole is asymmetrical, if the border is not well defined, if the color is odd, like black, blue, red, or white, if the diameter is larger than the diameter of a pencil, or if the mole is evolving. Book an appointment with your local friendly dermatologist and take a picture of suspicious moles so you can keep track of any changes. And finally, if you have a family history of skin cancer or fit a lot of the risk factors, even if you aren't concerned about anything in particular, consider booking an appointment if it's within your means to do so. Thank you also to everyone who shared their experience or loved one's experience with skin cancer. You all convinced so many people to get their moles checked out and very well could have helped save lives. On that note, I'm proud of everyone for committing to getting their moles checked. This was actually my mother, but it's good to know if you're a woman or no women. If you've been through menopause and your period comes back after over a year, get it checked out. It's probably nothing, but it can also be something. My mother is fine, fortunately. Yes, my mother had some spotting last year, over a decade post-menopausal, and it turned out to be cervical cancer. Since she went to the doctor immediately, they did a hysterectomy, 4 radiation treatments as a precaution, and she's totally fine now. Not me, but my grandfather had trouble breathing for a long time. Nothing horrible, just shortness of breath, heavy breathing, etc. But he had to take care of my grandma. He went to the hospital when he started coughing, a dry cough, unable to stop. They diagnosed cancer, aggressive form of lung cancer, and he died within 3 weeks. The doctor told us that if he had come earlier, they might be able to save him. My mother had a chronic cough for years. Every time she went to the doctor, he gave her an inhaler and allergy medication. Never mind that she smoked over a pack a day and a sprain she had gotten wasn't healing. Once she started rapidly losing weight, I knew it was all over. That small pain that never seemed to completely go away just under the left side of my ribcage could have saved myself the horrible experience of acute pancreatitis. Someone clarified this for me, so I apologize for causing mass panic. Here is what he said. Physician here. Chronic mild abdominal thoracic pain is not a symptom of acute pancreatitis. The more likely scenario is actual skeletal muscle pain in that region, which, as you can see from the comments, is extremely common. Acute pancreatitis, as I'm sure you know, happens rapidly, is very painful, and can be deadly if untreated. Chronic acute pancreatitis equals acute death, and isn't a thing. Chronic pancreatitis is a different beast entirely. Remember, correlation does not imply causation. Pancreatitis suck. Pretty uncomfortable pain, and you have to go through almost a whole week without any food or drink. Source: I've had around 25 episodes in my life, from 1998 to 2006, the last one. I was in my 8th grade, and I vividly remember the day I noticed that I couldn't properly see with my right eye even with my spectacles, and I thought that maybe I need to get my eyesight checked because the power of my glasses might have increased. I didn't give it much importance because I had exams, and after 4 months when I finally went to get my eyes checked, the doctor informed me to get to a bigger hospital because he felt it wasn't normal. I went to a specialist eye hospital, and they informed me that I was diagnosed with glaucoma and I had lost almost 90% of my vision in the right eye. Intraocular pressure, IOP, in the eye that should have been below 21 was 70, which is insanely high, and it was starting to affect my left eye as well, where it was 23. They didn't know why I was diagnosed with glaucoma cause it is very rare at that age. I had to get operated in my right eye immediately because medication wasn't controlling the IOP. I missed half of the classes in my 9th grade, and then finally I had to get operated in my left eye as well in my 10th grade right before my final exams to control the condition. I wish I could have been more careful and went to the doctor immediately. My son was diagnosed with glaucoma when he was 10 months old. Most likely he was born with it. He's also had both retinas reattached and cataracts removed from both eyes. I had problems walking as a child and had a big roll in my gait. My parents and the doctor thought it was a foot problem, so I was taken to a podiatrist and given orthotics, which helped. However, this didn't fix my pronated leg. Doctors then said I had growing pains, so my parents ignored the pain for a while, especially since I never really had too many problems playing footy and cricket. I guess I just learned to put up with the pain. After 18 years of pain in my legs and feet, I had a physio figure out that my hips didn't line up and that it was highly likely that I suffered a hip dysplasia during birth that was not corrected. My right knee and foot are ruining themselves now as a result of my right leg being shorter than my left. My father, he would be working around the house or at his job and would just trip and fall for no reason. Happened 3 or 4 times. Long story short, it was ALS and he died from it just over 3 years after those initial symptoms. High resting heart rate. I had a Fitbit and didn't wear it for a few months. When I went back to it, my RHR was 90 plus from 54. Went to the doctor and found I was in hypertensive crisis with a BP of 212/104. I'm okay now, but had a crappy Christmas thinking I was about to have a heart attack. A week before my 4th Halloween, I was playing on my Cat in the Hat scooter, fell on the pavement and got a good scratch on my knee. 24 hours later it starts itching pretty bad. Another 24 hours later I can't sleep, it's itching like crazy and getting red and hot to the touch. Mom thinks I'm being a drama queen. In her defense, I was a bit of a dramatic teenager and doesn't really look at it too closely. 24 hours later it aches so bad I can't walk and the itching and redness is worse. I end up in the hospital for a week with cellulitis that's so bad I come very close to amputation and or death. I had no clue at the time, but my mom said it was bad enough they told her to have relatives come visit just in case it was their last chance to do so. Doctor told my mom that if I had come into an office on the first or second day I may have gotten by with just a strong injection of penicillin and a week of oral antibiotics. They told her to have relatives come visit just in case it was their last chance to do so. And that, my friends, is how you know how close you were to death. I had a patient who had experienced persistent headaches for around 5 months. She had been to her local GP who told her it was just down to stress. He eventually referred her to me after her symptoms were getting worse and I diagnosed her with stage 4 glioblastoma, a very aggressive form of brain cancer. Sadly she died within 5 weeks. Her prognosis would have been far better if she'd come earlier. I feel like unfortunately women have to turn self-advocacy to 11 and turn off politeness to actually get help for things. A tiny unnoticeable lump in my throat turned out to be thyroid cancer. I wouldn't have even caught it had I not gone to my doctor just trying to get my hands on Chantix to quit smoking. So yeah, lose some sleep over that one. Hypochondriacs. They found my thyroid cancer after doing a CT scan for something completely unrelated. It was on the interior, pressing against my esophagus about the size of a pea. I would every once in a while feel a little bump but it didn't hurt so I ignored it. My endocrinologist told me I was really lucky to have caught it this way. I had no symptoms or issues otherwise to give warnings. My brother always complained about what he thought was a hernia. He also said he had respiratory infections and a couple other things that started looking more and more like he was becoming a hypochondriac. He also has a history of drug abuse and lying, so we all kind of took it with a grain of salt. Last week he went to the ER for stomach pain. After blood and urine tests, then a CT scan, they found what's most likely cancer in his groin area. Literally waiting to hear from my mom what the biopsy says right now. He's 39 years old. It's cancer in his left testicle and evidently lymph nodes behind it. They're removing the testicle and doing a biopsy on it to see exactly what kind it is. It can be one of 2 types, one of which will require chemo. They also have to do more CT scans of other areas to make sure it's nowhere else. This is reminding me too much of how my father died. I'm hoping it all ends well. My mother. 5 years ago she noticed her pinky would twitch. She was a truck driver at the time and didn't want anything interfering with her income, so she ignored it. Fast forward to 3 weeks ago, completely bedridden, spasms, weakness, unable to walk, eat, use bathroom without assistance, multiple system atrophy, P-type, looks like Parkinson's, but quicker symptom onset and much shorter lifespan. She'll be gone in 5-ish years. Please, if something isn't right, get it checked. I am so freaking sorry this is happening. Always being thirsty and frequent urination. I had a bit of a throat infection so it hurt to swallow most things. Chocolate milk and sweet tea felt good. Water at least didn't hurt. I avoided the doctor thinking it would go away and just kept drinking. At about the 1 week into being sick and mostly drinking sugar water I realized I was always super thirsty so I redoubled by drinking. I was peeing like once an hour but didn't think anything of it since I was drinking so much. Finally go to the doctor who does vitals and my blood pressure was dangerously high. They do more tests and my blood sugar was about 6 times normal levels. Turns out I was driving myself straight into a diabetic episode by self-treating an infection with sugar water. After some research I found that the unquenchable thirst and frequent urination are warning signs you need to get to the doctor. Remembering hearing frequently having to wake up to pee and waking up super thirsty and needing to drink in the middle of the night is a sign of it. Lower left back hurt like heck for months. Same spot has hurt quite often in my life due to sleeping on tiny sofas after a friend's party too often or just generally crappy posture while sitting. So I ignored it a bit, did some stretching and whatever but it got worse. So one day I couldn't really move anymore. I lived with a roommate who wasn't home at the time, so it took me well over an hour to walk the 20-minute way to the hospital. Told them about my hurting back. Took them about 5 or 6 hours to find out that my kidney was inflamed like heck and had been for the last weeks. Spent a week in the hospital, shivering and in pain, just because I thought I knew what's up. Lesson: I never know what's up. If you ever experience similar pain and then start to get shivers at night, go to the hospital immediately. BC one of the very next steps is kidney failure according to my doctor. Similar problem, right side. Thought it was a kidney stone. Past a kidney stone. Pain kept coming back. Turns out a hernia on top of it. Left side's doing the same thing and I'm wanting to file a warranty claim on this body. I started to get stomach sensitivity when I was drinking. I could have 2 beers and throw up. Then my eyes got inflamed and they gave me a steroid drop and sent me on my way. I didn't think about it much, but my health got worse and worse after that until I lost 20 pounds in a month, and then I thought, I think this isn't a stomach bug anymore. I ended up being diagnosed with ulcerative colitis. I have a lot of people messaging me that they had undiagnosed Crohn's that they cured with a probiotic. Number. Stop. IBS is not the same as IBD. IBS is not autoimmune. My immune system attacks my colon. It's not an oversensitivity to food. My immune system also attacked my eyes and my joints. I cannot just take a probiotic and cure it. If you believe that, you have a severe misunderstanding of the disease. It took a colonoscopy and a biopsy to diagnose me. You are not going to cure MS, lupus, AIDS, celiac disease. That's not how that works. There is no cure. Additionally, that's great if your loved one is doing fine with no medication and just with diet. That doesn't mean the disease is controlled. Scar tissue with buildup and can lead to cancer. I didn't come to Reddit for advice. I have multiple doctors for that. I just wanted to tell my story. Thanks. I had a DVT which started out as a pain in my back that wouldn't go away. I put it down to a pinched nerve as I was 24 weeks pregnant at the time. By the time I got to hospital 3 days later, my leg was swelling and going purple, which I also chalked up to overexertion the first 2 times it happened. I had an extensive clot which genuinely could have killed me. Not me, but my mother. There were several years where it was clear her energy level was declining and she was getting more tired, more irritable. It was definitely something noteworthy, but gradual. I remember the first time it was brought up to the doctor, they felt it was just related to age or menopause. But within a year after that, my mother was so tired she could hardly get out of bed. Turns out her thyroid was basically shutting down. Over the year or 2 this built up. By the time we had a diagnosis from an endocrinologist, she essentially had no thyroid function. Same thing recently happened to my older sister 2 years ago. So anytime I seem less energetic than usual, my family goes into full-blown freakout trying to make me go get blood work done. I really hope this can help some people struggling with unexplained health problems. Thyroid issues definitely have a genetic link, so I encourage everyone who has a familial history to watch out for themselves. I know I do. I wish everyone currently working on finding their proper treatment plan the best of luck. I hope your problems get managed soon so you can really get your lives back. That's the thing about thyroid issues. You never know you have it until you get it checked essentially. I was always thirsty. I would guzzle down water, but it wouldn't ever be gone more than an hour or so. I would sleep and wake up with my lips dry and cracked, and my mouth dry as bone. But the doctors didn't think anything of it, and since it started slow and went on so long, neither did I. And then my vision went bad. All I got was a shrug and a no. That just happens sometimes. And when it went back to normal a few weeks later, nobody batted an eye. I was traveling a few months later when out of nowhere, I couldn't eat. I couldn't shower without puking. I slept for 18 hours a day and couldn't walk more than a few blocks at a time. When less than a week before I had spent the whole day on my feet. My mother was begging me to call an ambulance, and when I did, I finally found out what was wrong with me. It turned out my chronic thirst was caused by type 1 diabetes. My pancreas wasn't working, and my body was trying to get rid of the excess glucose through urination. Things weren't going great for all those months, but when it combined with a lung infection, my potassium plummeted to critical levels. I spent 2-3 days in hospital and was attached to about 3 IVs at a time. TLDR. Developed diabetes at 20. Felt fine other than being thirsty. Them were some crappy doctors. All those telltale signs of diabetes. and no one bothered to do a blood sugar test, which isn't exactly expensive nor work intensive. Get your dang eyes checked. Doesn't matter if you have 20/20 vision, or think you do, you should get a yearly checkup from an optometrist. I have never had a problem with my vision, and just last week my wife made an appointment with the optometrist for the both of us. Well, it turns out I do have 20/20 vision and good peripheral vision, for now, but the optometrist also discovered I have a rare disease, pigment dispersion syndrome, most often found in people between 20-40 years old. A clear indication of this is Krukenberg spindles on the cornea, where pigment from your iris sloughs off and floats freely in the aqueous humor. It can get lodged in the drainage system of your eye, thus causing increased intraocular pressure. When this happens, it's called pigment glaucoma and can lead to permanent blindness. So despite otherwise good eyesight, I have a possibility of going blind at a pretty young age. There are no signs of open angle increased intraocular pressure, the kind caused by pigment glaucoma, and the damage is permanent. Get your dang eyes checked. Not me, but my mother never went to the doctor. I'm not really sure why, but she would just refuse to go no matter what. She didn't often get sick, so it was usually just something we let slide. One day she was particularly sick. She seemed like she had a pretty bad fever, but she still refused to go to the doctor. Eventually we gave up convincing her to go, but we told her that if she was not better the next day we would make her go. She agreed to that. I remembered being awake most of the night playing PC games and hearing my mother mumbling to herself in her sleep. My bedroom was right next to my parents' room, texting my sister about it, and agreeing that no matter what our mother would go to the doctor the next morning. Unfortunately, she never made it through the night. Apparently she had undiagnosed diabetes and died of heart problems related to that. It really hurts knowing that something as simple as getting a regular checkup could have prevented this from happening. Had an irritable bowel and one day found a speck of blood on the toilet paper. Doctor said it was probably nothing but get a colonoscopy just in case. 9 months later my colonoscopy is ready. Almost didn't go as I didn't see any blood after the initial time. They removed 80 odd polyps from my bowel. A couple more years and the chance I would have had bowel cancer was like 80%. If I didn't get that colonoscopy I would have had bowel cancer by now. I was 28. I'm 31 now. So now I get 10-15 taken out every 12 months for the rest of my life, yay. I get blood every time on the TP. Doc says it's from fishes, but every time I see someone talk about their terrible illness and the first clue is TP blood I worry. Not me, but my dad. He scraped his cheek with a branch while working. After a few weeks, it still wasn't healing. He figured he had opened the wound while sleeping and gave it no afterthought. Fast forward 3 months, wound still unhealed. He starts feeling weird things around it, so he goes to a dermatologist. Skin cancer. After 2 rounds of chemo, each 6 months long, the cancer is still not gone and just started a 3rd. Yeah, my dad had an infection in his hand that he was taking care of himself, but his fingers began to bulge. We wasn't going to go, but I told him he needed to because I couldn't see his knuckles anymore. He went the next day, and if the infection had spread it would have been very bad, like losing an arm or death bad. I just had frequent headaches and crazy itching skin, all the time for about 8 months. The itchy skin was worse than the headaches. Never comfortable, and I always thought bugs were biting me. I even had an exterminator check my entire house. One particular day I had a really bad headache and went to urgent care. I was 24 at the time, so when they said that my blood pressure was 240/140 I really didn't get the severity of it. They sent me for stress tests etc. a month or so later. I did all that. But what they failed to do at the hospital that day was to take blood out of me. I went for my follow-up a month later where they did take urine and blood work. I had stage 5 kidney disease and needed dialysis as soon as possible since my numbers were so bad I was close to dying. Check your blood pressure and get blood work done regularly. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.